Often forgotten by society, revealed unexpected challenges to Lakiesha Burton. When the system responsible for providing their health care began to fail, she faced a critical decision: remain silent or speak up to truly serve those who couldn't advocate for themselves. At great personal cost, she chose courage and advocacy. Her journey of standing up, facing resistance, and finding a new path is one you won't want to miss. I'm your host, Megan Babcock, and I'm just so thankful, Lakiesha, for you joining me today and your willingness to share your story.
Thank you, Megan, for having me. I'm happy to share my story.
Well, let's just give our listeners a little background about you as a nurse and some of the different roles that you've had and how you went through your career in becoming an administrator and coming to a place in your career where you had to stand up for your patients.
Well, I began my career as a nurse and bedside nursing. And then an opportunity came, and I gained all the extensive knowledge and skills from bedside nursing, and an opportunity came up, and I was, assigned to an outpatient unit. And so, working in the outpatient unit, the role I owned was that, all the clinical skills and so forth that I have, it helped me to be a leader. And so I was transitioned into a leadership position, and I became a manager for a unit. And there I was able to train new staff that were coming into the unit. I was assigned to even precepting nursing students who were coming out of college, because I am not the one who would be like, you hear nurses eating their youngs. I'm the one who like to take care of my young ones. And so I used that opportunity to train them. And so from there, I moved on to be a nurse educator in that whole outpatient department. And from there, I actually had to relocate. And relocating, there I took on a position as a nurse administrator.
That was a big change, you went from bedside to being in a leadership role, and then here you are as a nurse administrator of a pretty big unit that you were taking care of.
Yeah. And so because I recognized the fact that, I had that passion for leadership, I pursued further studies, and moving on into further studies, I felt like, I had more that I wanted to give. And being involved with patients, I wanted to ensure that they were getting the all the resources that they would need in order to get the care that they would need.
So in your hospital situation where you were and you were going up through the ranks before you had to move, it sounds like you felt like you were really supported with the management and being able to have the resources. And then in this new opportunity as the nurse administrator, tell me about that. Did you have the resources that you need? Like, what ultimately led you to saying, I can't work and be aligned with the care that I'm giving in this current
So
situation?
I really loved my positions that I had, being involved in all the care that I needed to do for patients. And so after learning about, going on so many different trainings, and learning about putting myself in the shoe as a patient and to understand their perspective, whenever they're there in the unit, or we have some communication, I took on this position as an administrator, and it was just so different. It was different where I did not have the support of the higher management. We were so short staffed. I was getting complaints from patients on a daily basis. And here I am. I'm like, no, but there has to be someone who should be able to advocate for the patients. But then I find myself now in the position where I also had to be the nurse. The
Mm,
nurse, and putting aside, I had to do nursing plus administration, and so that got really overwhelming. It's like I'm
mhm,
okay. I need to do this because I don't have enough staff, and but then administrator, and then my bosses are asking for things for administration, where okay, what do I need to prioritize? Do I need to be able to deal with the patients, to provide their needs, to meet their needs, but then now I have to do administration because administration needed, and I felt really overworked. I felt like
mm,
I was just getting burnt out because I was not able to provide the resources that the patients needed. And when you're not being able to provide all the resources that patients need,
mm.
I can say it gets a little bit frustrating. It does.
Yeah, well, I can only imagine. And, we're not here to just talk bad about the healthcare system. We are both nurses and have been nurses for a long time. I don't know, I've been a nurse for 22 years. You've been a nurse for how
For
long?
20.
Okay. Yeah. So it was something you felt called to at a young age. Like you loved helping people. So, what we are talking about is just the reality of our current system is not working the way it was intended. And so, it can be really difficult when we have to stand up, but we have to be true to ourselves at the same time,
Mhm.
and we committed to not cause harm, to do good by our patients. And so our listeners, I want you to hear that it is not easy as a nurse to stand up and to advocate for our patients, and that there's a lot of pushback when it comes to the administrative side of things and the business side of running these hospitals and units. And but at the end of the day, as a nurse, we feel called to advocate for you as the patients. And we believe that as we're standing up for what's right, that there will be a ripple effect, and hopefully that we can begin to see change in a broken system. We believe that there's hope that things can get better, but we also have to stand up and use our voice. And the same for you if you're listening as a patient or you have a loved one. Knowledge is power, and really understanding kind of what's going on in the care that you are receiving, and really checking in with yourself. Like, how do you feel about it? Right? Because we have to check in with ourselves. And I've left that side of healthcare, and I'm more focused, just as Lakeisha is, in this solution for providing better healthcare. And in our next episode, we're going to dive in a little more this pivotal moment for Lakeisha when she stood up, how it was challenging, but what it taught her about herself and where it led her to. Thank you so much for being here with us. Don't miss out on this next episode. And if you are struggling with a chronic disease or something where you're feeling like you're just not getting the care that you deserve, we're here to advocate and help you through that process. So feel free, drop a comment. We will connect with you. Or you can share this if you know someone who is struggling within the healthcare system. Thanks so much for being here, Lakeisha, and we'll see you guys in
Thanks.
the next episode.
Thanks, Megan, for having me.